G'day guys, how are you? Look, in a previous video that we did, we discussed our action plan or our primary survey. As I said, we'll go through CPR. So this session is just very quickly going through CPR. So again, after we've done our response and sent for help, we're now looking at the airway. So with your pistol grip, looking inside the airway or looking inside the mouth for any blockages, broken teeth, blood, vomit, etc. And if we do find that, obviously we're going to roll the patient over on the side. In a next video, I'm going to show you how to roll a patient over into the lateral position, stable side position, etc. Once we've found that the patient has nothing in their mouth, so the airway looks to be clear, we can now open the airway. Here, we're going to put our ear down to the patient's mouth. We're listening, we're feeling, and we're looking for rise and fall of the chest. If there's no breathing, so we have no response and no breathing or not normal breathing, they're the two things that we're looking for that now say the patient has no signs of life. The treatment for someone who has no signs of life is CPR. So in this video, I'll take you through CPR. So the first thing we're going to do is find the centre of the chest. Okay, so the first point we want to find is where the ribs join up to your sternum. This part down here, where it joins up, is called the xiphoid process. Along here, we have our sternum or breastbone. Up here, you've got that floppy bit. It's what's called the suprasternal notch. They're your 2 points that you need to be able to identify. We're then, with the use of the thumbs, we're going to look or trying to find the centre of the chest. And as you can see, I'm in the centre of the chest. I'm going to leave my top hand in place, take my bottom hand away, and with the heel of the hand, put that back. And that is finding the centre of the chest. The other way to do this is to find where the ribs join onto the breastbone or sternum. You can have 2 fingers there and bring that hand back across there, and that then will find the centre of the chest. Once you've found the centre of the chest, we're now going to provide 30 compressions and 2 breaths. That's called 1 cycle. So you can see that I'm compressing around about between 100 and 120 compressions a minute. I'm compressing approximately 1/3 the depth of the chest, and I'm compressing in the centre of the chest. After the 30 compressions, we're now going to stop. And if you are willing to, or you're okay to do that, you can provide 2 breaths. So with your pistol grip, head tilt, open the airway up, and we're going to give the patient 2 breaths. These should be done fairly quickly. Then moving straight back onto chest compressions. Again, 30 compressions and 2 breaths. If you're unwilling to breathe through your patient, as in breathing, you just continue on with your chest compressions, and you're going to compress between 100 and 120 compressions a minute. 1/3 the depth of the chest and compressing in the centre of the chest. We carry this out until our patient is showing signs of life. Okay, so as previously mentioned, 30 compressions and 2 breaths is 1 cycle. We're going to provide 5 cycles in 2 minutes. And we'll continue to do that. There are 4 reasons to stop CPR. The first one is that you're placed in danger. And if you remember when we talked about the primary survey, that was the most important thing. Another reason to stop CPR is that medical help arrives and takes over. The ambos arrive on scene. Maybe it's the fireys arrive on scene and are now taking over CPR. You provide that assistance until they're ready to actually take over. Don't leave them, because I want to know some more information. The third reason to stop CPR is if you're fatigued, you're too tired. And the fourth reason is if your patient is showing signs of life. So if your patient is now responding, making noises, etc., or they're now breathing normally, this is when we're now going to roll our patient over onto the side. We're going to stay with them and we're going to monitor them. Thank you.